Health Focus is brought to you by National Medical Stores, NMS, passionate about your life.
Grace Adiba lives with diabetes. She only got to know about it at the age of 13 when she started experiencing some discomfort with her general well-being.
So I was experiencing the signs and symptoms of diabetes, but I really didn't know. I was having excessive thirst. Every time I would want to drink something, I would frequently urinate, but I ignored them since I was young. I didn't know. So we went into Christmas, we had fun, but I was always taking more and more soda.
At the time, Adiba and her family had no idea that she had diabetes. Adiba recalls a time when she woke up and was so weak to do her daily routine. She was rushed to hospital after her health deteriorated, and on arrival at the hospital,
The doctor advised that they would check my sugar levels, and when they did, the glucometer read HI, which means that my sugar levels were too high to be measured by the glucometer. So that's when I received the news of that turned my life around, that I have type 1 diabetes.
Type 1 diabetes, previously known as insulin-dependent, juvenile or childhood onset, is characterized by deficient insulin production and requires daily administration of insulin. In 2017, there were 9 million people living with type 1 diabetes. The majority of them live in high-income countries. Neither its cause nor the means to prevent it are known. Diabetes is a chronic disease that occurs either when the pancreas does not produce enough insulin or when the body cannot effectively use the insulin it produces. Insulin is a hormone that regulates blood glucose. The other two types are type 2, which is characterized by deficient insulin production and requires daily administration of insulin, and gestational diabetes, which occurs during pregnancy. Dr. Hafsa Kasule, the technical advisor for non-communicable diseases at the World Health Organization Uganda office, says the prevalence of diabetes in Uganda could be higher than documented.
3.5% in terms of percentage is small, but when you apply it to 45 or 43 or 40 million, it's a big number. Most times, we don't even have the equipment, even if you suspected. Okay, we need the equipment, like we call them glucometers, where you can test the blood sugar. They are not commonly available. Even at regional referral, you may not find many later on at primary health care, where people go most of the time. Diabetes is the leading cause of amputation. The blood, it affects blood vessels, and then when they are blocked, the part that is not supplied dies. That's what we call gangrene. And once it dies, they have to cut it off.
And the reason?
People are getting bigger in size, what we call overweight or obesity. People are drinking more, which also affects the pancreas, which produces the insulin. People are smoking more. So these risk factors, and people are exercising less because we are moving into an electronic age.
Diabetes takes a toll on one's well-being, and for Adiba, it was worse.
I got fed up and I wanted to commit suicide because of that, because I was going through a lot of pain.
Diabetes, especially type 2, can be prevented by a change in lifestyle, including maintaining a healthy body weight, exercising regularly, eating a healthy diet, and avoiding excessive use of tobacco. Otherwise, treatment is lifelong.
The cost is really high. It's really expensive, and that's why my parents got a relief when I joined the foundation, because it was having a big toll on them. Yeah, it's quite expensive. But we have tried to reach out to the government, and nothing has been done yet. Right now in the market, I think one insulin vial is like at 30,000 shillings. And then each syringe is 700 shillings. Yeah. And the pack has like 10 syringes inside.
In 2019, diabetes was the direct cause of 1.5 million deaths, and 48% of all deaths due to diabetes occurred before the age of 70 years. Another 460,000 kidney disease deaths were caused by diabetes, and raised blood glucose causes around 20% of cardiovascular deaths. Walter Mwesije, NTV.
National Medical Stores, NMS, passionate about your life, with support from the Ministry of Health. Procure, store and distribute essential medicine and medical supplies to all government health facilities.